Good afternoon. I'm George Latimer, Westchester County Executive, and this is our Monday, January 11th, Westchester Coronavirus Update, the first of two updates that we do each week. We'll do another one on Thursday to give you an idea of where we are in dealing with the pandemic here in Westchester County. As we did at the last update, we wanted to talk about our vaccine distribution issue first, because that is the one that's on most people's minds. The coronavirus numbers are continuing to climb. They're very serious numbers, but I'm going to hold off giving you those numbers until we talk a little bit about the vaccine distribution process. As we all know, within the last month and a half, a number of major pharmaceutical companies have developed, and FDA has approved vaccines for distribution all across the globe. And Westchester County is a portion of the state of New York, and the state of New York obviously is one portion of the United States of America. So there is a massive distribution challenge all across the world, and certainly here in the United States. With that thought in mind, we're eager to help you get the vaccine. We want to be able to do it in as timely a fashion as possible. But this is a very fluid situation. As I'm sure you can appreciate, this is something that government has not done as a normal function of what we do every day. It's very important. I want to be very clear about this point. New York State is the governing authority for what happens with all COVID-related issues, and in this case, in terms of COVID-19 vaccination distribution and registration. The state of New York has set the rules in place in the same way that they have at the beginning of the pandemic to determine what businesses would be open or closed, in the reporting documentation from various testing sites and the extent and the necessity for testing, and now in terms of vaccine distribution, New York State is laying out those rules. The County of Westchester is trying to work, as all counties are, to implement the policies that the state executive branch has created. And of course, there's going to be innumerable questions that will come out of this process. We will do our best as county officials. We'll work with our local officials and to try to do the very best we can to be helpful to you in this process. But it will take time for all of this to be done. And particularly as we start to get information in real time, we will share it with you in real time. We had a phone conversation this morning with various school superintendents. We have one scheduled shortly after this update is finished with municipal officials, cities, towns, and village officials, as well as members of the County Board of Legislators and the state legislative delegation, so we can share what information we have and then to try to implement it. We are currently in concurrently phases 1A and 1B of the state structured distribution of the vaccines. Now, it's very important for you to check the New York State webpage, the Department of Health webpage, which will give you the up-to-date information. We will try on our Westchester government page to give as much information as we can aside from these updates. There is a website connection to determine your eligibility and your vaccination location. This is very critical. This is, and I believe it's on the screen, you'll see it as mieligible.covid19vaccine.health.ny.gov. The first most important element is to determine if you fall into one of the eligible categories for which a vaccine can be given. Given my circumstances, what I do professionally, my age and my health, I am not in 1A or 1B categories, and you have to determine if you are in order to know if it is timely for you to set up an appointment for a vaccination. Who is eligible in this category? There's quite a lot of them here, and I'm going to go through the whole list to the best of our ability. And now that we have come through today, Category 1B, Phase 1B is now in effect. The 1A phase, which existed prior to today, was a more narrow definition. It has been broadened, but it is by no means a universal point at which every man, woman, and child is eligible to get the COVID vaccine. Right now, under Phase 1B, we have teachers and education workers, all first responders, that means police, fire, as well as previously eligible EMS individuals, public safety workers, and that definition can include correction officers, probation officers, and so forth, public transit workers, here in Westchester County, Beeline bus drivers, those who drive paratransit vehicles, people who are 75 years of age and older. I don't reach that threshold. Those of you who reach the age of 75 or older are eligible to receive a vaccine now in New York State under this Phase 1B. High-risk hospital workers, emergency room workers, ICU staff, pulmonary department, and so forth. Residents and staff at nursing home and other congregate care facilities. those federally qualified health center employees, as I mentioned, all EMS workers, coroners, medical examiners, and certain funeral workers, the staff and residents of various state-sponsored facilities, OPWDD, OMH, there's all acronyms that represent what we generically call group homes. Urgent care providers are eligible to receive the vaccine. Individuals who administer COVID-19 vaccines, including local health department staff, they are eligible, obviously, to get the vaccine prior to administering the vaccines themselves to others. All outpatient and ambulatory frontline high-risk healthcare workers of any age who provide direct in-person patient care. All staff who are in direct contact with patients. All frontline high-risk public health workers, including those who are conducting COVID-19 tests, handling COVID-19 specimens, and vaccinations. Doctors who work in private medical practices and their staffs. Doctors who work in hospital-affiliated medical practices. Doctors who work in public health clinics, all eligible. Registered nurses, specialty medical practices of all types. Dentists and orthodontists are eligible. Psychiatrists and psychologists and their staffs. Physical therapists and their staffs. Optometrists and their staffs. Pharmacists and pharmacy aides are eligible. Home care workers, hospice workers, and the various staff from the nursing homes and skilled nursing that did not receive a COVID vaccination through the Pharmacy Partnership Program, which began this process. Now, the state has set out all of those categories as people who are eligible. If you are not in one of those eligible categories, in essence, if you are healthy, if your job, work, career does not put you in the healthcare or related field where you're involved in what's considered an essential project to continue the functioning of the society, as most of these folks are, then you would have to wait until the next phase comes into play. The people who are aged 75 years and older will primarily be vaccinated at pharmacies and other sites that are part of the retail network. This is established by the state of New York. So when you go on, if your eligibility factor is because you are 75 years of age and older, then you will get a drop-down chart of places that you can sign up for appointments, and it's going to primarily be targeted to pharmacies in the retail network. Not all pharmacies. Do not rush out to your local pharmacy and say, I am 76 years old and I want a COVID vaccine. That is not the way the system works. Every person must register in order to receive a COVID vaccine in the state of New York. This is the state-sponsored policies. Beginning today at 4 o'clock, just a little less than 2 hours from now, the state COVID-19 vaccination hotline opens for scheduling vaccination appointments. Now, we have a phone number here. I believe we have it on the chart. I'll mention it to you. It's 1-833-NYS-4-VAX, V-A-X. The actual number is 1-833-697-4829. And that is a vaccination hotline created by the state of New York, which you will be able to access starting at 4 o'clock today. Now, the demand is so great that we expect these websites to become overloaded at the outset, and very clearly, because this is a first time through, you may experience this delay. You may experience that the sites are shut down for various periods of time. At the county level of government that I'm responsible for, we don't control these vehicles. We tell you what the system is as it's been laid out, and then we are trying to work to help implement the various elements of the vaccination program as the state has set it down. But that phone number that I mentioned has been established by the state for scheduling vaccine appointments. Before you can receive the vaccination, you must fill out a New York State COVID-19 vaccine form. The form has to be completed online, and I think we're showing the location for it, forms.newyork.gov and so forth. You will get a submission ID, and then you have to complete that. If you have a relative who is of the age of 75 or older, they may find it difficult to follow such directions. They may find it inconvenient to use a computer to take care of these things. Help them accomplish this task. It's very important. There is no alternative way of doing this. It has to all channel through the electronic system that the state has established. And if seniors need some assistance, then please give that assistance if you can. We have, as a county government, started the process of reaching out to the various senior centers, mostly recreational centers around Westchester County. Many of them are shut down from the normal programs of services, but we've reached out to them to get a handle on what levels of programming they're doing and what level of contact they have with senior citizens. And with that thought in mind, we're trying to schedule for tomorrow a webinar event on one of the various platforms, Zoom, WebEx, whatever it'll be, to talk to those individuals, give them some information to help so that they can then in turn get it out to the people that are active with the senior centers. If you have an aged parent, or if you yourself fall into this category and you are not in a nursing home where you would already be eligible for vaccination and you're over the age of 75, then knowing this information and maybe being helped, walked through it, will help you with it, because you will be asked to make certain decisions on the website in order to get the vaccination. For example, you'll have to identify what radius of distance around where you live you want to see eligible sites. Well, if you say a 10-mile radius wherever you live, that's what's going to come up on the screen. If you put 50 miles in, or you put no figure in, and it winds up with a large number, you'll see places a long distance away from where you are that aren't relevant to what you're doing. Not all of the sites that will come up are ready to take applications for appointments today or for tomorrow. Some of these sites are still going through a certain amount of working through the specifics. We'll talk about ours in a second at the county center. And so you might be able to get on and look and say, oh, here's a location, and when you check it, they don't have vaccine product yet. And this is part of the complications of trying to deliver such a large number of vaccines to such a large number of people. But with each of these different questions, the first question is, are you eligible? And you can find that out online. If you are eligible, you can go online and you can submit an application for an appointment. And if the system is up and operative, which if it isn't now, hopefully it will be fairly shortly, you'll be able to make the appointment. You go, you honor the appointment, and you get the first of what will be 2 shots. You will get a second shot depending on the kind of vaccine you've been administered, either 3 weeks or 4 weeks subsequently. And the second shot is important. That booster shot helps activate the benefit from the first shot. You cannot take the first shot, walk away, and think that you're equally as protected from the virus. And that is the purpose of taking the vaccines. We don't take the vaccine for sport. We take it to protect us from the virus, so it gives us some greater confidence that even as we wear masks, even as we socially distance, it reduces dramatically the likelihood that we will get the virus. And that's a very important thing. I spoke to a couple of friends of mine who came down with the virus. They've gotten through it. They've made it through the 2-week period, but they got very severely sick. And these are people who are in an age category where you wouldn't expect them to get terribly sick. But if they were 30 years older than they are today, or 20 years older, and any other health issues have come into play, this could have been very serious. And that will reflect in the numbers that I share with you. So take this seriously. At the same time, understand that on this day, Monday, January 11th, the beginning process of opening up to a wider group of people has started today, and the demand will most likely tax the system as it has been created by the state. We in the county will try to be helpful as much as possible, but the hotline information, when you have a nuance, when you have a problem, something that doesn't fit into what you're filling out for it, you have to get it answered through the hotline that's been established by the state of New York. We all want the answers quickly. We all want the vaccine as quickly as we can, and it's very important for us to try to do our job within the parameters set down by New York State. Now, Westchester County government received last Tuesday, 500 doses to be administered. And those 500 doses were given to the county. They were administered through our White Plains Department of Health clinic on Court Street, not far from where I'm standing in the county office building. And through Friday, we were able to properly deliver all of those 500 units to those who are eligible in the 1A category. And 1A was a smaller version, a subset of all the different categories I just mentioned before, focused on health workers and so forth. We were able to vaccinate a portion of the county workforce, not all county workers. Those county workers, Department of Health nurses, Department of Social Service nurses, those individuals in labs and research that perform a function within the coroner's function, or handling specimens and lab materials at labs and research. Those individuals were assisted through this process, and then we also made it available to other eligible categories of people, some of the doctors and the things that we've talked about before. We were given an additional allocation of 330 doses Friday midday to the afternoon, reallocated from another source. Through the course of Saturday, we kept the clinic open on Saturday, administered another 105 doses. As we're speaking now, that more of those doses will be given out until we complete the additional 330 for a total of 830 doses administered. Now, that is by no means an impressive number when you compare it to the challenge ahead of us. The important thing is that we as a county government are doing that which is in our lane. And when I say that our job is to implement the state policies, that's an example of it. If we get doses of vaccine, we make sure that the right people get it. They get it quickly, they get it efficiently, and we earn the right to have more doses that we can deliver to more people that are in need. I want to take this opportunity to thank Dr. Charlita Amler, who is our Commissioner of Health. You've seen her here many times. We had a town hall meeting last week as she leads the health department. I want to thank Renee Recchia, who is our first deputy commissioner of the health department. He does a terrific job. And in terms of the work that's being done at the clinic up the block, Lori Smittle, who has a doctorate in nursing and is supervising what's happening there. I myself have been tested in that location for COVID twice with the swab testing, and they've worked very professionally. And I want to thank Lori Smittle, Renee Recchia, Dr. Charlita Amler, and the full team in the health department for their work in getting out these doses. The operations have resumed today at the clinic. They will continue again tomorrow on Tuesday. We believe we'll use all the doses that we've been allocated by the end of Tuesday. And if we're given additional doses, we'll make sure we get it out within the same parameters that I've just discussed, 1A and 1B recipients. The hotline that we've referenced for information is very important. I'm sure it'll pop up on the screen at various times when I'm talking, and make sure that you write it down and make some notes about it. Now, the Westchester County Center. Almost a year ago, the Westchester County Center transitioned from being a sports arena and an exhibit hall into a medical facility. And at that facility, it was reconfigured with tents outside to accommodate 110 hospital beds to handle the peak of infection in COVID. You've seen the peak infection lately in California and in Arizona, which have taxed the hospital systems in those states. You saw over a year ago the taxing of the hospital system in Italy and in China, when the initial outbreak of this had far more people ill and requiring hospitalization than there were available hospital beds. We have not reached that point here in Westchester County, so we're using that facility, and we're going through a final walkthrough in the next 24 hours to make sure all is at the specifications that the state has set down for the purposes of a vaccination center. But it will not be a walk-in facility, meaning you can walk up to the front door, give some information, sign a few forms, and go in and get a vaccination. You may see that phrasing show up in the online reference. It says walk-in. They don't mean that you can walk in at will without an appointment. It means it is a site you access on foot, as opposed to an access that you will drive through. And there are, and I assume there will be, drive-through vaccination settings, just as you've had a drive-through testing situation at Glen Island for almost the last year. So, but it's very important, and people must operate with a clarity of complete information. If you misunderstand the words that I'm saying right now, and you don't double check them, and you just go off and he said I could walk in, you'd be misinterpreting what I'm saying. You cannot just walk in to the Westchester County Center. You will be going in vain. You will not be able to get a vaccine in that fashion. So let me repeat again, whatever you may see, the county center, when it is turned into a vaccination facility, it will accept only those to be vaccinated based on appointment. And the state is being very precise about what they allow for vaccination purposes. They have said at the outset, for those with 75 and older, that's the broadest category of any of these categories that I've mentioned. Everybody else is a person with a particular work responsibility, and a fairly narrow number of people fit into those categories. Even if there are hundreds of them, there are hundreds and not tens of thousands. Once we open it up to the general population, which is what 75 and older is, even though that is a relatively small cohort of all the people in the general population, that the intent is to control, through the state of New York, those people getting vaccinations. And with that thought in mind, we hope in our partnership, County Health Department and the Westchester Medical Center, that the county center will be open as a vaccination facility by appointment, and we'll talk more about that on Thursday. The anticipation is it will open on Wednesday, but there's a final walkthrough. If anything is untoward, since we're dealing with people's health, we'll delay the opening to make sure it's right on. But we believe it is correct, and it is on stream. All of those things relate to the vaccination issues. I'm sure there are questions showing up in the chat room. And we've been getting phone calls all day from people that have expressed that. I've seen it in my everyday comings and goings. We will respond by email to every request that we get for information, but most of the time you will ask a question that is not within the authority of the county government to determine. I am more than happy if given the authority to make decisions like that. But the authority resides in the governor and the staff around the governor. They are controlling that so that the policies are not the policies in any one county or any one county executive, but policies that are statewide. He has that authority. He is using that authority. So I defer to the state making those decisions, and we will try to do our best to explain to you the information that we have as to what's happening. So let's talk about the infection side of the equation, which is not good. It's getting worse every single day. In some ways, if we did not see the light at the end of the tunnel in the vaccine coming as the way out of this, I'm not sure what I would say, giving you what are fairly grim numbers in terms of the infection. The infection is spreading. I believe we're starting to look now what would be the spike that follows not just Christmas, but New Year's. And like you, I've gone on Facebook. I've, danced around and looked at different people's pages. I've seen combinations of people, Happy New Year, here we are all together. You weren't in Times Square or Renaissance Square in White Plains to watch a ball drop, but people were together in private settings, and these numbers reflect that continued growth of the infection. As of the numbers we had yesterday, January 10th, we have 10,894 active cases of COVID, those individuals that have tested positive and are not clear protocol for 2 weeks. In a strange cyclical nature of these things, that was almost the exact same number we had on April 10th. The first case was March 1st. We exploded with COVID in this area on April 10th. We had 10,890 cases. And so now, all these months later, even though we dipped all the way down, flattened the curve, and done so many things that we were very pleased with, we have now reached 10,894 active cases. That is on the basis of 77,731 total positive tests year to date through the 10th of January, and 66,837 people that would have cleared protocols. So the number is 10,894. That number is jumping dramatically, as I've said before. If we go back a week before, the number was 9,278, so that's an increase of 1,600 in 1 week. If we go back 2 weeks ago, the number was an even 8,000. So that's a 2,800, almost a 2,900 increase in 2 weeks in active cases. And if you go back to a month ago, and I have all these statistics that I clutch before I go to sleep at night, a month ago we were at 8,500 cases, and now today we are at 10,000, roughly 900 cases. That's a significant jump. The last date we have information for on hospitalizations is Saturday the 9th. On Saturday the 9th, 504 people were hospitalized in Westchester County for COVID. The good news, to the extent that there's good news about this, is our bed count is much higher than that number, in the vicinity of 2,500 to 2,600. The number has differed over time. I originally thought we had a number about 3,000, and that number has oscillated back and forth. We have not reached the crisis situation that you've seen in Los Angeles or Arizona. But just as when we reached the crisis situation, there were parts of the country that felt, well, that's a New York problem. That's not going to touch us. I would be foolish to think the way they did all those months ago, that somehow somebody else's bad numbers won't come to roost on our front doorstep. We do well to consider that the very high number of infections and the very high number of hospitalizations tells you that this is important. This is important to keep you from getting this and to keep you from giving it to somebody else. You use this or you abuse this or you ignore this at your own peril. These numbers are not going down, and there's a reason why. The number of hospitalizations at 504, still, however, represents a much higher number than what we've seen in past weeks. The week before, the number from 504 was 455, so that means an increase of 50 individuals over the course of a week are now hospitalized that were not a week ago. It's probably about a 10% increase. We were at 392 2 weeks ago, just shy of 400, and 353 3 weeks ago. And you get the picture. If I started to flip back to the beginning of October, to the end of October, on Halloween night, October 31st. Halloween's not that far ago. 51 people hospitalized, 10 times as many people now hospitalized. So we have 1,730 deaths to COVID. The death total is 9 people from Sunday over Saturday. We had 8 people over that period of time. In the prior week, we lost 49 people to COVID. We had prior to that 1,681. We now have 1,730 individuals. That is a significant number of individuals, 49 people that have expired. And the prior week we were at 38, and the prior week we were at 37. So if this is a continuing trend of greater fatalities, we are losing a higher percentage of people to COVID. When we did our Ribbons of Remembrance, we were outside in the field, and we talked about the tragedy. And I spoke, with a certain amount of passion because of the people that I know that have suffered because of COVID. That was on a Thursday, December 3rd. And at that point in time, we decried that 1,525 people had died of COVID. From that day, when I stood out, there's a picture of me in the media next to all of the ribbons on the wooden device that we created. From that picture to today, we've lost over 200 people to COVID. So the numbers are not good, and wishing them to be better does not make them so. We have a vaccine coming. It is the responsibility of all of us to figure out how to get the vaccine out. The state has the responsibility for it. The county needs to be diligent in working with the state. We will do that. We know that there's a fair number of people that don't believe that they feel comfortable taking the vaccine. Some of it may be philosophical. Some of it may be, their doubt that they can trust the government. There's 100 reasons why. There's no reasons to repeat them. We intend over the next few weeks to share some testimony from people who have taken the vaccines, those who are medical professionals, people of all different backgrounds, walks of life, as a means to try to give some comfort to those people who have a certain fear factor about taking the vaccine. If we decided not to take the vaccine, let's assume every one of us, knowing that there was a vaccine, decided not to take the vaccine, what would turn this around for us? What would turn this around? I've just said we've lost 200 people over the course of a certain period of time. What stops that then? And we're still, going into the heart of a very cold winter season. This is just midway through January. We've had a couple of nice days since we had the snowstorm about 3-4 weeks ago. There's no other path out. There's no other path out. So you be practical and make the determination. What are you risking by taking the vaccine? What are you risking by not taking the vaccine? That's really your choice. It's not, do I know everything I could know about a vaccine? Let me be candid. I'm not a person of science, and most likely, if you're watching, you're not either. There are things that we do in everyday living. I've made the joke, both on the air and with my friends. You eat things, hot dogs, chicken nuggets, and Pop-Tarts. You have no idea what's in those products. You have no idea how good it is for you. You probably have a vague idea that it's not good for you, and I'm no different than you. I eat hot dogs and, and so forth. But for people to talk about their fear about taking the vaccine, when the greater fear staring you in the face is the possibility of death, and even if you recover from COVID, an ongoing level of physical injury to you, breathing capacities, things that you haven't died, but you're not yourself as you once were. These are all the things that are possible if you get the virus. The idea of the vaccine is so you don't get the virus at all. It protects you from getting the virus at all. And those numbers that I've just shared are pretty sobering, I would think. A couple of other issues that we'll touch on before we go to questions from the press. There's a lot of frustration in the village of Portchester, which is right next door to near where I live. It has been established in an orange zone capacity a little over a month ago by the governor. Some other areas had yellow zone capacity. Yellow zone, orange zone, and red zones, which we don't have here, are restrictions established by the state on how those communities functions. And they identified schools, houses of worship, restaurants, and general businesses. 4 separate categories of impact, and then increasing levels of restriction of activity in yellow zone, orange zone, and red zone. There is a concern out there that our politicians aren't doing enough. Let me state it clearly. The zone structure has been created by the state government, state administration, under the direction of the governor, with the advice of the health people around him. Your village mayor has no control over the zones, right? Your state senator has no control over the zones. Your village trustee, your county legislator, your county executive has no control over the zones. The decisions reside in the executive authority that the governor is using to make a statewide principle. They designate the zones, and if necessary, they adjust the requirements within the zones. And we were able to lobby for an adjusted requirement within the zones that would allow for a different way to interpret what would happen to schools in an orange zone, red zone setting. However, the infection numbers are what they are, and they're serious. They're not to be laughed away. It's not, we're hurting, open everything back up. So your elected officials in Portchester and elsewhere where you have yellow zones, we have proposed ways to readjust the zone in ways that we think would allow for appropriate levels of business activity without advancing the infections. And that's a balancing point. It is not simply open it up. It's not simply close it all down. It's a balancing point in between. And every one of the officials, if you're watching this from Portchester, every one of the officials, both sides of the aisle, have lobbied for certain changes that we think would be advantageous, would allow restaurants to function at a certain appropriate level and not advance the contagion. I'll give you the obvious example if you've watched these reports, even if you've watched them intermittently over what is now 11 months of this pandemic. We made a point, having controlled our recreation at Westchester County, to determine which types of recreation could be open, which types of recreation would have to be closed, and which types of recreation would have to be regulated if it was going to be open. And we made those decisions practically in real-world time. We were given that authority. That authority was not taken away from us by the executive branch of the state. So we made decisions. We closed some things. We closed Playland Amusement Park. We closed fireworks displays. We closed the ethnic festivals at Kensico Dam, all of which are wonderful things. I look at Playland, on a regular basis, living right adjacent to it. I love the place, but we had to close it down, had to lose it all summer long. It's a terrible thing, but that was what was necessary because that particular entity could not function under the rules of the pandemic. At the other side of the coin, we were able to open up with modicum of changes the 6 public golf courses. Why? Because golf is a socially distancing sport. It's not a contact sport. You don't cover somebody in golf that you're competing with the way you cover them if you're playing football or hockey or basketball. And we were able to get through a miraculously successful year of golf at our 6 public courses. In the middle resides our pools and our beaches, where we know that we've got a recreational facility very much in demand in the summertime. You go to a pool, you go to the 2 beaches to cool off, and you have to be able to provide that set of recreation, relaxation for people in Westchester County. But we added components that made it different and more controlled. There were plexiglass, there was social distancing, a smaller quantity of people, and we were able to successfully keep open our four of our pools and 2 of our beaches without having to close them and without spreading the disease. So it can be done. It's the rational point of view in between the extremes of open everything up or close everything down. We managed to navigate that during the summer of 2020, and I think successfully in terms of our recreation programs. That is what we are seeking for communities that are in the orange zone capacity, like Portchester, as relates to restaurants. We're trying to be able to lobby for a change in policy. And let me speak to a truism of life which applies in this particular case to trying to get people to make a decision within the world of politics. When you have conflict in your family, conflict if you're a child with your parent, parent with your child, between siblings, between spouses, with more distant relatives that you may not see every day, how do you structure that disagreement? Well, you structure that disagreement based on your personality and your relative's personality. I have been in situations where I had my parents scream at me. I've had times where I've lost my temper with my daughter. I've had times when I've sat down and made intelligent common cause with relatives over problems that we had. Sometimes big problems, sometimes little problems. Sometimes little problems set you off more than the big problems do. There are people who want to change public policy when it's controlled, in this particular case, by a single entity. The state executive branch, the state administration run by the governor, sets these rules. But a person who disagrees with them wants to see lobbying that is aggressive and loud and in your face. It satisfies the anger that they feel. Perhaps there's a partisan basis to it. It's whatever. It's whatever makes you feel something. The effective lobbying to make change does not happen in the newspaper, and it does not happen with how loud I raise my voice. I was a Little League baseball manager in my younger years. I can yell pretty loud. I don't lose my temper very much. My staff will tell you it's a fairly uncommon thing to watch me lose my temper, which is unusual for those folks who are in positions like mine, where many times you deal with people who have very short tempers. We believe that the only path to changing these considerations is the path in which we use logic, we use reason, and we use arguments, and we are persistent. And if we don't get what we want on day 1, we push on day 2, and we push on day 3, and we push on day 43, because that is what will change it. I can assure you that if I yelled back at my father back when I was a kid, I would absolutely not win the argument with my father. In fact, it would become infinitely worse. So you either trust or you don't trust your elected officials. If you don't trust us, you don't trust us. We're politicians. I get it. Trust me, I've heard it far more than you think you've said it to somebody have I heard it. We are trying to change public policy using the power that we have when we have it. If it's in my authority to say stop doing something, I will do it like that. If it's not within my power, if it belongs to a different individual, you read the circumstances and you try to influence the circumstances to the way you'd like it. It may not be what you want to hear. It may not prove to be dramatic, but it's the only way that can possibly be effective. It was effective in changing policies that related to schools and testing in the orange zone. And that's what we're trying to accomplish as well for Portchester. And I can speak clearly that the mayor of Portchester, the state senator for Portchester, the assembly member for Portchester, the county legislator for Portchester, the members of the village board of both political parties, myself and my executive team, we're all on the same side. We are trying to make some changes in the implementation of that orange zone that would make it more fair for the restaurants and in general the people of Portchester. Let me have another somber note that I want to share. I hate to dwell in the world of sympathy and death. Unfortunately, if we did not have this pandemic at hand, it would be the rare opportunity to speak of somebody's life and times rather than their passing. But I have to relate that we have lost a really wonderful Westchester resident, a gentleman by the name of Peter Woods. He's the co-chair of our 9/11 Related Illnesses Committee. Now, you know that on 9/11, we lost 3,000 Americans in both the Pentagon, the field in Shanksville, and at the World Trade Center. But we've lost many, many more Americans in the aftermath of the health issues that came from what happened on 9/11, particularly in the debris in the pile in lower Manhattan from the crashing of those two buildings and the pollution and the carcinogens that were let loose by that. Peter Woods was a first responder. He's a retired New York Police Department sergeant, and locally here he performed the function as a former commissioner of the Hartsdale Fire Department. He worked at Ground Zero for 5 months. And in those 5 months, Peter saw the incredible task of trying to put back together something that was destroyed out of malice and evil. In recent years, he's been committed to preserve the memory of his fellow first responders, and we have made a commitment, which has been delayed now because of the COVID crisis and our ability to accomplish certain things during this pandemic, to honor the people who have died in Westchester County from 9/11 related causes. We have out at Kensico Dam Plaza the beautiful sculpture of the Rising. It is magnificent. It was created under the aegis of my predecessor, County Executive Andy Spano. It was done with private generosity. Jim Houlihan and so many other people did so much for that to rise up. And it remembers the Westchester residents in the circle of pavers around the base of the sculpture, those people who died that day. But many other Westchester people have died doing exactly what Peter Woods has done. And so we want to honor those individuals. We're committed to doing that. And in the process of putting together a committee to try to work through these things, Peter Woods stepped forward, was willing to be helpful in this committee. And now we've lost Peter. So we send out our sympathy, our condolences to his wife, Sarah, his two daughters. People talk oftentimes about what is the legacy of a person. And, if you reach a certain level of notoriety, I guess they'll name some major thing after you. It's really hard to think about those things while you're still alive. And when you're healthy, you don't worry about those things. But for Peter Woods, his legacy is certainly in the hearts of the people that knew him. And this monument will be built. I hope we can do it in an approximate period of time. I hope we can unveil it at a future 9/11 in person, not just virtually as we had to do the last 9/11. We don't know what the circumstances will be. But Peter Woods gave his greatest amount of devotion to his fellow human beings in both his fire service in the city and then later as a commissioner in Hartsdale, as the commissioner of the Hartsdale Fire Department. We owe Peter Woods that monument. We owe Peter Woods and all the Peter Woods out there who lived in Westchester and died from 9/11 illnesses. We owe them that debt of remembrance and that debt of gratitude, which we extend to Peter today. With that, I'm going to invite Catherine Chaffee, our Director of Communications, to let us know if we have any questions from the press.
We have the first question comes from David Proper. He asks, while this is still in the early stages of vaccinations, what meaning does it hold for you to see the county center open up as a facility that'll help reverse this pandemic?
David Proper from Lowhood. I want to make sure I remember to repeat the names of the reporters so that they're credited for their hard work on this. David Proper from Lowhood, or the Journal News, as we know, the newsstand example of it. What's interesting, David, is that when I came into office in January 3 years ago, the county center issue that was most on my mind was the issue of gun shows. And then secondarily, we had an issue where we had lost for the spring of 2018 the basketball tournament, the finals for high school Section 1 basketball. And I thought to myself, this is a heck of a situation. We have a gun show there, but we don't have high school basketball. And coming out of Mount Vernon High School, which is a great basketball power in the county, I thought it would be a crowning achievement to bring them back in. And we did. By 2020, it took a couple of years, and we worked it out, and we got to see the finals played for Section 1 basketball. Within 2 weeks, we closed the center because of COVID. And the next time that I was on the floor where I had seen the basketball finals being played was to see the construct of hospital rooms on the very same floor where I had seen basketball being played. So the county center is an asset that belongs to the citizens of Westchester County. If you note, the very first thing I did in office all those years ago was to take my name off all the buildings. I'm the first county executive not to have his name in front of every park or on every public building. And I did that symbolically. It was a symbolic statement. It was a statement to say that we put the people of Westchester above the county executive of the moment. And I always talk about, the amount of time you have in a job and that somebody else will have this job after you, and that's just part of the situation. It means a lot to me to know that the county center can save lives now. As important as it is to entertain people, my father took me there when I was a little boy because he was a coin collector. We used to have the Westnex coin shows there. I didn't love coin shows. I loved being with my father, and I'd walk around with him as a kid and then later as a teenager wishing I was with my friends, but walking through the very county center that I walk through now. Of course, I think of them all the time. And I think if the county center can be used for vaccinations, if those vaccinations can help us stop the hemorrhaging of deaths that we've had, and I look at today's number and it's 200 more than another day number, then I think it's a good use. The original plan for the county center was not to use it as a medical facility. It was never envisioned to be used in a pandemic, but we use it in a positive light. Glen Island's a wonderful facility. great beach, great walking area, picnicking area. It's been out of action. And every so often I get complaints, and rather angry complaints, from people who live in the area. They want their Glen Island back. They want to walk around. They want to enjoy the sound. And they don't necessarily want to see it sacrificed for something else. But right now, Glen Island is being sacrificed for something else, and so is the county center. And if we can effectively get vaccinations out to a large number of people, if those vaccinations can save their lives, and I hope they do, then it will be the county center will be well used, and at some point in time, in my lifetime, I'll see Playland open, and I'll see Glen Island open, and I'll see the county center open, all of which I had such pride in when I first walked in the door as county executive. But for a variety of reasons, they're not open now, and they will be open, and there will be laughter and joy in the county center yet, but it will take us through this pandemic to get there.
The next question also comes from David Proper from Low HUD. Has there been any discussion of what will happen if hospitals are overrun and the county center needs to be used for hospital care rather than vaccinations?
Well, the flexibility of transition will be there because the basic structure inside the building that was created for separate hospital rooms will not be deconstructed in order to do the vaccinations. In essence, inside the building, you have approximately 56 hospital rooms, and those 56 hospital rooms will be used as vaccination areas for individuals that can come in, get the vaccination. They have to be watched for 15 minutes before they're allowed to leave the premise to see if there's any initial reaction, immediate reaction, and then they're let go, and then the next person can come in. So the physical structure of what's inside the building will not change so dramatically that it can't be retrofitted to accommodate an overflow of hospital patients if we get to that point. We are not near that point as we speak today, but obviously as we get closer to that point, we would have to have in round numbers 5 times the numbers of people hospitalized today in order to tax our available beds, total available beds in Westchester County. So, if that number started to continue to rise dramatically, if we saw us at 1,000, at 1,500, at 2,000, then, the state, which again controls all of these things, state controls the facility. We help, we help use it and staff it under the direction of the state. Then there might be a reconfiguration back for hospital bed purposes. But the basic inside structure will allow us to put hospital beds in those rooms. We're not deconstructing the internal system of the center. Right now, we believe it is better used for vaccinations, but we'll see what happens with the hospitalization needs.
And the next question, which is the final question, comes from Nikita from News 12. She asks, we've received a lot of calls from folks calling places that are supposed to be giving out vaccines and being told that they don't have vaccines yet. Is the county receiving similar calls? And if so, what is the county telling these frustrated people?
Well, we're receiving some of those calls as well, Nikita. Nikita Ramos from News 12. And we also are trying to track down the hardcore information. Our team went on to the state website today. We looked at some of the locations, and we made some notes about how many of them that we know of are up and operative. And we don't know how many doses. It hasn't been delivered to us to know how many doses have been given out to each of these locations, and how soon these things are going to happen. So we get back to people who inquire to us with as much general information as we can. Just as I came on to give this update at 2:00, we heard some concerns about the website. The website has been the main conduit for directing an individual. Go to the state website, and all answers will follow from that. If that website is not up and operative, what we will do is, as people call and complain, they're upset. We listen to them. We certainly try to understand their anger and frustration, so as not to add to that by being brusque in our behavior. But we take names and email, phone numbers, informations for communications purposes. And when things are structured in a way that they can resolve their problems, then we will contact them back and give them information that will help them get through the situation. But, again, we're in the first phases of a distribution to a larger group of the general public. And this is, this is something that we haven't done before, the royal we, not the county. And so we're trying to be helpful to the state and we're trying to do the things that we can do that will be effective. I gave you the examples earlier about how Westchester County handled specifically the doses that we were given. We are, as a government, accountable for how those 830 doses get disseminated. And we were able to do the first batch appropriately, and now we have a second batch that we're trying to do appropriately. When we tackle these things, we try to tackle them as practically as we can. But we understand, and you've seen us do this from time to time, we will adjust. We will change directions if we think we're heading in the wrong direction. We are not embarrassed to say, you know what, we just thought that was the right strategy. Not the right strategy. Here's a better strategy, and move in a different direction. I think obviously people are frustrated and they're anxious and they want to get the vaccine because it will protect them from this disease. So I certainly understand why they're upset. We can't answer their questions because we don't have the authority to say, hey, go over to such and such a place. They have doses. Tell them with this authority they can give you a vaccine. We don't have that authority. And it's important to understand that. I think, people don't take a course on government, that they have to pass in the middle of their lives. They think of government monolithically, and they think somehow that we're all making common decisions. We've been tried very hard to have good group relations with local governments, but that is not the standard way the county government has worked over the years. So we're trying our best, and I know that individuals are frustrated. We're trying to deal with their frustration, give them as accurate information as we can, and get them to the vaccine availability as fast as we can. I think we're going to have a tough couple days as we start the week. I'd like to think it'll get better. If you want an analogy, remember early voting. Now, we didn't control that either. That was the Board of Elections. They're a separate entity. The county administration did not control the Board of Elections. The first day of the Board of Elections early voting, there was tremendously long lines. People were hugely upset, and we had nothing but negative feedback coming to us who had no control over it. Within a couple of days' time, the Board of Elections changed their hours. They changed their access for some availability. They responded to the demand. And by the end of the early voting, we had record numbers go through. And then most people, by the end of it, not the ones who voted the first day, they're pretty upset. But once we got past that initial shakedown cruise, we had a fair bit of people who were complimentary for the work that was done. And that's the same kind of footprint. We're having problems on day one with the state system, maybe with the state website. We will work through it. What's the alternative? I gather this is my last question, so I'll just close with this. What's the alternative? The same question I asked you if you don't want to take the virus. Tell me your alternative. Tell me your alternative. Tell me your alternative if the website crashes. You're angry. You want to raise your voice in anger. You want to pound a table. That doesn't get you the vaccine any sooner. You think people don't listen to you because you're not listening to the people who are trying to convey the information that we have. We're trying to work through a system that is being tested for the first time at this level of intensity. The first time you put your head under the hood of a car, did you know how to fix the ping that you heard? It was trial and error until you learned how. You can't do it now because it's a completely different, substructure. But the first time I ever put my head under a car, it took me all day to figure out what was wrong with it. And that's what we're trying to do. We're trying to figure out what's wrong and make it right. And we would do well in this world, as angry as we can get, is to remember that anger is not the only emotion that we can work with. There is something to be said for faith and perseverance and self-discipline and controlling your emotions. We saw enough emotions last week run wild. We don't need any more of the emotions run wild. We'll work together. We will get through this. You will get your vaccine, and so will everybody else. In due time, I'll get mine. You'll get yours. We'll be safe from this virus. We will shed this. We will open Playland. We will have basketball again at the county center. We will walk on the beach at Glen Island. All of those things will happen, but you have to have faith that they will happen, and you have to have the perseverance to get us to see us to that day, and we will get to that day. I'm George Latimer, County Executive. Thank you for tuning in. If you have any questions, you can reach out in the press. You can reach out to Catherine Chaffee. We'll try to answer those offline. You can communicate with us through the many means that we have. 995-2900 is our offices here on the 9th floor. We're happy to do it. Your county legislators are working very hard on your behalf as well. I hear from every one of them every day. And they, too, are pushing hard, and we will work together. We'll get through this. Thank you very much. Stay safe. Have a good day.